During a breathing cycle, we take in oxygen during inhalation while removing carbon dioxide during exhalation. Alveoli are the tiny air sacs that are arranged in cluster within the lungs where the gas exchange of the oxygen and carbon dioxide molecule takes place. And for it to function properly, the amount of the ventilation must match the amount of the perfusion in the alveoli of the lungs. This means that there should be a balance in the ventilation and perfusion ratio. Ventilation refers to the amount of the air that enters and leaves the alveoli. For the body to able to obtain oxygen, there first must be sufficient amount of the air that reaches the alveolar region of the lung. Perfusion refers to the amount of the blood that flows to the alveolar capillaries. For the body to be able to obtain oxygen, there also must be sufficient amount of the blood passing through the lung to pick up oxygen molecules so that it can be transported to all the organs and tissues of the body. Dead space ventilation is defined as wasted ventilation or a condition in which ventilation is in excess of the perfusion. There are three types of the dead space: anatomical dead space, alveolar dead space, and physiological dead space. The volume occupying the conducting airway that does not take part in gas exchange, that is called anatomical dead space. Normally, the conducting airway contributes to about 30% of dead space ventilation. For a tidal volume of 500, the anatomical dead space will be 150 ml. The anatomical dead space provide warming, humidification, and filtration of the inspired air. The normal lung volume that has become unable to take part in gas exchange because of reduction or lack of pulmonary perfusion is called alveolar dead space. Pulmonary perfusion may be absent or low because of the decreased cardiac output, as seen in the congestive heart failure or blood loss, or due to the obstructed pulmonary blood vessels, that's seen in the pulmonary vasoconstriction, pulmonary embolism. Physiological dead space is the sum of the anatomical and the alveolar dead space volumes. Under normal condition, the physiological dead space approximates the anatomical dead space. In disease condition, where alveolar dead space ventilation is increased, physiological dead space becomes higher than the anatomical dead space. With the help of Bohr equation, we can easily calculate the physiological dead space. Vd by Vt equals to PaCO2 minus PeCO2 by PaCO2. PaCO2 is the arterial carbon dioxide tension and PeCO2 is the partial pressure of carbon dioxide of mixed expired gas sample. Vd is the physiological dead space and Vt is the tidal volume. In patient on mechanical ventilation, Vd by Vt ratio, that means the physiological dead space to tidal volume ratio, less than 60% is considered acceptable, and this value suggests adequate ventilatory function upon weaning from mechanical ventilation. Severe and prolonged dead space ventilation causes insufficient ventilation, muscle fatigue, ventilatory failure, and oxygenation failure.